The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of the 1,000 plus submissions, only a select few have become quarter-finalists.
Over 3,000 acute care hospitals and thousands more ambulatory, behavioral health, and value-based care organizations have implemented Collective Medical. One example of an integrated workflow is Collective's ability to surface synthesized content to the point of care within a hospital. The ED trackboard representation here shows that for every patient presenting to the hospital, Collective is able to analyze at the onset of that visit if a patient presents with clinical insights from other providers or presents with certain risk factors that have been identified from prior hospital encounters. For example, high utilization trends, presenting to multiple EDs in a short period of time, safety and security alerts, history of multi-drug resistant organisms, and many more. In addition to sending Collective notifications to the hospital, Collective Medical has deployed a true bidirectional solution through Smart on Fire. This native integration allows providers access to patient data gathered from across the network, as well as the ability to input care insights that are pushed back to Collective, removing the need for providers to exit the EHR and log into a third-party solution. This allows providers and clinicians to communicate information more effectively on patients to other healthcare organizations in the community without ever navigating away from their EHR.
Hear in their own words why they should win.
This is Mandara Singh, the Senior Vice President of Collective Medical. I wanted to start by saying thank you to the judges for nominating us in the EHR Innovation Best in Class category. I'm here to tell you a little bit more about Collective Medical. As I think about the components of what it takes to drive better outcomes, at Collective Medical, we really think about it in 3 categories. You have data, so our ability to aggregate data across multiple points of care, thousands of hospitals. But then it's really what you do with that data that makes a difference. How you derive data or collect user-generated insight within the workflow means that providers don't have to swivel chair to understand what's important about their patients. And it means that every stakeholder in that patient's health knows that when they put an insight into our platform, it is reaching a provider who is truly engaged in that patient's health and is able to understand that information. So today, across thousands of hospitals, we integrate with provider workflow and care workflow so that these entities and these stakeholders in a patient's health can not only understand from our network what's relevant to the patient in front of them, but can share that information that they have that may be unique to their experience with the patient across a vast network of other providers who are also stakeholders in that same patient's health. When you put this all together, the result of this care coordination has significant impact. First and foremost, on the lives of those vulnerable patients that we help these stakeholders coordinate around, to ensure that these patients don't fall through the cracks and that the next provider they see has a comprehensive view of what might drive the best next step for this patient. But the impact to these providers is also significant. And so as we look at these numbers, they're pretty meaningful in terms of driving down the cost of overall care, driving down avoidable visits to the hospital, and overall helping our healthcare system work more efficiently and more in service of the patients who need us the most.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.